Vitamin D. Functions, sources, and benefits. Vitamin D, often referred to as the sunshine vitamin, plays a crucial role in maintaining overall health and well-being. It is a fat-soluble vitamin that the body can produce in response to sunlight exposure. However, many individuals worldwide are deficient in this essential nutrient. In this comprehensive video, we will delve into the functions, sources, and benefits of vitamin D, as well as explore the potential risks associated with its deficiency. Functions of vitamin D. Calcium and phosphorus absorption. One of the primary functions of vitamin D is to regulate the absorption of calcium and phosphorus from the intestines. It promotes the synthesis of calcium-binding proteins, which enhance the transport of calcium across the intestinal lining into the bloodstream. Adequate levels of vitamin D are essential for maintaining proper calcium and phosphorus levels, which are crucial for bone health and mineralization. Bone health and mineralization. Vitamin D plays a pivotal role in maintaining optimal bone health and integrity. It works in conjunction with calcium and phosphorus to support bone mineralization, ensuring that bones are strong and dense. Vitamin D stimulates osteoblasts, bone-forming cells, to produce proteins needed for bone matrix formation. Insufficient vitamin D levels can lead to weakened bones, increased risk of fractures, and conditions like osteoporosis or osteomalacia. Regulation of parathyroid hormone, PTH. Vitamin D helps regulate the secretion of parathyroid hormone, PTH, from the parathyroid glands. PTH plays a vital role in maintaining calcium and phosphorus balance in the body. Vitamin D suppresses the production of PTH, preventing excessive release of calcium from bones and maintaining its adequate levels in the blood. Immune function. Vitamin D plays a critical role in modulating the immune system. It helps regulate immune cell function and cytokine production, which are important for immune response and inflammation regulation. Adequate vitamin D levels are associated with enhanced immune function, reduced risk of infections, and improved defense against certain autoimmune diseases. Cell growth and differentiation. Vitamin D is involved in cell growth and differentiation processes. It regulates the expression of genes involved in cellular proliferation, maturation, and differentiation. Adequate vitamin D levels are believed to support normal cell growth and prevent abnormal cell proliferation, potentially reducing the risk of certain cancers. Muscle function and strength. Vitamin D is essential for optimal muscle function and strength. It plays a role in muscle cell contraction and relaxation. Adequate vitamin D levels contribute to improved muscle performance, reduced muscle weakness, and enhanced physical performance. Mood and mental health. Emerging research suggests a potential link between vitamin D and mood regulation. Vitamin D receptors are found in brain areas associated with mood and cognition. Some studies have indicated a correlation between vitamin D deficiency and an increased risk of depression, seasonal affective disorder, SAD, and cognitive decline. However, more research is needed to fully understand the mechanisms involved. Cardiovascular health. Vitamin D has been associated with cardiovascular health. Adequate levels of vitamin D may contribute to maintaining healthy blood pressure, reducing the risk of cardiovascular diseases, and supporting overall heart health. It may also have beneficial effects on blood vessel function and inflammation regulation. Blood sugar regulation. Vitamin D may play a role in glucose metabolism and insulin sensitivity. Studies have suggested that adequate vitamin D levels are associated with a reduced risk of developing type 2 diabetes and improved glycemic control in individuals with diabetes. Blood pressure regulation. Some evidence suggests that vitamin D may have a role in regulating blood pressure. Optimal vitamin D levels have been associated with lower blood pressure and a reduced risk of hypertension. Anti-inflammatory effects. Vitamin D has been shown to possess anti-inflammatory properties. It helps modulate the immune response and suppresses the production of pro-inflammatory cytokines. Adequate vitamin D levels may help reduce chronic inflammation, which is implicated in the development of various diseases. Brain development. Vitamin D plays a crucial role in brain development, particularly during early stages of life. It is involved in neuronal growth, differentiation, and synaptic plasticity. Sufficient vitamin D levels during pregnancy and infancy are important for normal brain development and may influence cognitive function later in life. Hormone regulation. Vitamin D is involved in the regulation of several hormones, including insulin, renin, and parathyroid hormone. It helps maintain hormonal balance and proper functioning of various endocrine glands. Skin health. Vitamin D has a role in maintaining healthy skin. It helps regulate cell growth and differentiation in the skin, contributing to proper skin barrier function. Some studies suggest that vitamin D may be beneficial for certain skin conditions, such as psoriasis and eczema. Cancer prevention. While more research is needed, there is evidence to suggest that vitamin D may have a protective effect against certain types of cancer. Adequate vitamin D levels have been associated with a reduced risk of colorectal, breast, and prostate cancers. Signs and symptoms of vitamin D deficiency. Vitamin D deficiency can manifest in various signs and symptoms, which may vary in severity depending on the degree of deficiency. It's important to note that some of these symptoms can be subtle and easily attributed to other causes. If you suspect a vitamin D deficiency, it is advisable to consult with a healthcare professional for proper diagnosis and treatment. Here are some common signs and symptoms associated with vitamin D deficiency. Fatigue and general weakness. Feelings of tiredness, lack of energy, and overall weakness are common symptoms of vitamin D deficiency. If you frequently feel fatigued, even after adequate rest, it may be worth considering your vitamin D levels. Bone and muscle pain. Deficiency in vitamin D can lead to generalized bone and muscle pain, often described as aches or tenderness. Individuals may experience back pain, joint pain, or muscle cramps. In severe cases, it can contribute to conditions like osteomalacia or rickets, characterized by softening of bones and bone deformities. Impaired wound healing. Vitamin D plays a role in the healing and regeneration of tissues. Deficiency can lead to delayed wound healing, prolonged recovery from injuries, and impaired tissue repair. Bone loss and increased fracture risk. Inadequate vitamin D levels can compromise bone health and increase the risk of bone loss and fractures. This is particularly relevant for older adults, as vitamin D deficiency can contribute to osteoporosis and the risk of fractures. Depressed mood and emotional changes. Some studies have suggested a link between vitamin D deficiency and mood disorders such as depression, anxiety, and seasonal affective disorder, SAD. Low levels of vitamin D may affect neurotransmitter function and impact mood regulation. Hair loss. While it is normal to lose some hair every day, excessive hair loss or thinning of hair can be a sign of vitamin D deficiency. Vitamin D receptors are present in hair follicles, and deficiency may disrupt the normal hair growth cycle. Weakened immune function. Vitamin D plays a critical role in supporting a healthy immune system. Deficiency can increase susceptibility to infections, frequent colds and flu, and impair immune responses. Impaired cognitive function. Some research suggests that low levels of vitamin D may be associated with cognitive decline and an increased risk of conditions like Alzheimer's disease and dementia. However, further studies are needed to establish a direct causative link. Decreased bone density. Vitamin D deficiency can lead to decreased bone mineral density, making the bones more porous and prone to fractures. This condition is known as osteopenia, which can progress to osteoporosis if left untreated. Slow healing of bone fractures. Insufficient vitamin D levels can impede the healing process of bone fractures. It may take longer for fractures to mend, and the risk of complications during the healing process may increase. Increased susceptibility to infections. Vitamin D plays a crucial role in regulating the immune system. Deficiency can weaken the immune response, making individuals more susceptible to infections such as respiratory tract infections, influenza, and respiratory syncytial virus, RSV. Respiratory issues. Vitamin D deficiency has been associated with respiratory conditions such as asthma, chronic obstructive pulmonary disease, COPD, and an increased risk of respiratory infections. Inadequate vitamin D levels may contribute to the development or exacerbation of these conditions. Poor dental health. Vitamin D deficiency has been linked to dental problems, including tooth decay, cavities, and gum disease. Sufficient vitamin D levels support oral health by promoting proper tooth mineralization and maintaining a healthy oral microbiome. Impaired balance and increased fall risk. Vitamin D plays a role in maintaining muscle strength and coordination. Deficiency can affect balance and increase the risk of falls, especially in older adults. Falls can lead to fractures and other injuries. Cognitive impairment in older adults. Studies have suggested that vitamin D deficiency may be associated with cognitive decline and an increased risk of developing conditions like Alzheimer's disease and dementia. Adequate vitamin D levels are believed to support cognitive function and protect against age-related cognitive decline. Sources of vitamin D. Sunlight. Sunlight is a natural and significant source of vitamin D when ultraviolet B, UVB, rays from the sun interact with the skin. A reaction occurs that triggers the synthesis of vitamin D. Spending time outdoors, especially during midday when the sun is at its highest point, can help boost vitamin D production. However, factors such as geographical location, season, time of day, cloud cover, skin pigmentation, and the use of sunscreen can affect the amount of vitamin D synthesized. Fatty fish. Fatty fish are excellent natural sources of vitamin D. Some of the fish highest in vitamin D content include salmon, mackerel, trout, sardines, and tuna. Consuming fatty fish regularly can contribute to meeting your vitamin D needs. Cod liver oil. Cod liver oil is a supplement derived from the liver of codfish. It is known for its high vitamin D content, along with vitamin A and omega-3 fatty acids. Cod liver oil has historically been used as a source of vitamin D, particularly in regions with limited sun exposure. Fortified foods. Many food products are fortified with vitamin D to help individuals meet their dietary requirements. Common fortified foods include cow's milk, plant-based milk alternatives, such as soy milk and almond milk, orange juice, breakfast cereals, and some yogurts. When purchasing these products, check the labels to ensure they are fortified with vitamin D. Eggs. Egg yolks contain small amounts of vitamin D, although the exact amount may vary depending on the chicken's diet and sunlight exposure. Eggs can contribute to your overall vitamin D intake. Mushrooms. Some types of mushrooms, such as shiitake and maitake, have the ability to synthesize vitamin D when exposed to sunlight or ultraviolet light. Consuming these mushrooms can provide a natural plant-based source of vitamin D. Supplements. In cases where obtaining sufficient vitamin D from sunlight and diet is challenging, vitamin D supplements can be used under medical supervision. They are available in two main forms: vitamin D2, ergocalciferol, and vitamin D3, cholecalciferol. Vitamin D3 is the more bioavailable form and is considered more effective in raising blood levels of vitamin D. It's important to note that these signs and symptoms can also be related to other underlying health conditions, and a thorough evaluation by a healthcare professional is essential for an accurate diagnosis. If you experience any of these symptoms or suspect a vitamin D deficiency, it is recommended to seek medical advice to determine the appropriate course of action. Subscribe to my channel, like, share and leave your comment below.